control. Active is muscles. But muscles don't do anything unless the brain tells them to. Bones are passive. They don't do anything unless a muscle contracts around it. So both the active and the passive systems come back to the control. And the control is the brain. So when people come into my office and I ask them what their problem is, hi, welcome. And I ask them what their problem is, most people tell me it's pain in their neck, pain in their back, pain in their hip, pain in their knee. But that really isn't where the pain is. The pain is in the brain. Okay, has anybody here heard of phantom limb syndrome? Okay, phantom limb syndrome is when people have an amputation and they still feel the pain in that limb, right? Because the pain is never where you feel it. The pain is where it's being perceived in the brain. Whether it's arthritis, whether it's degenerative knee problems, okay? In my office, I see people with the most degenerative knees. They feel fine. And then I see someone with just a little bit of bone spurring and they can barely walk. Because it's the way the brain perceives what's actually happening. So this is really the purpose of these talks, is for you to understand what stress is. Okay? Now tonight we're focusing mainly on physical stress as it pertains to coming from the ground up. In a month from now I'm doing one on emotional stress. Periodically I'll do one on chemical stress, what we put in our body. They all do the exact same thing to your brain and nervous system. Your brain and nervous system have to adapt to the stressors that it's under. Okay? Now, I don't know, can people see this? Okay, I really didn't intend to, but since it's a small group and there's a table, I might as well have used it. So, most of us perceive stress as emotional stress, as we were talking about. But how often do I hear someone tell me, well, no, it's not emotional stress. I get my headache or my elbow pain or my knee pain when it's about to rain. Right? So it's not stress. Well, let's break that down. What happens outside when it's about to rain? The temperature and the pressure difference outside changes. Every joint in your body has a little capsule around it. So if the pressure outside changes, the pressure inside those joints change, and you end up getting more pressure, more physical stress on the body. The nervous system has to adapt to it, and you end up getting the pain. There isn't any kind of example you could give me that I couldn't bring down to one type of stress: physical, chemical, emotional, or electromagnetic, which is all the computers and cell phones and wires and everything else. Okay, so the most dangerous thing that people can do is base your health around how you feel. Okay? Your symptoms are the least of your problems at the beginning because you don't feel anything, and then all of a sudden it becomes this major issue. But I guarantee you the knee problems or the finger problems that you have today started 40, 50, 60 years ago in some cases. When you base your health on how you feel, it's very misleading. Okay? Ask someone. I don't know if in this room anybody has relatives that have had a heart attack, right? Ask most people how they felt the week before they had a heart attack. They feel fine. My dad was 53. He had a massive heart attack playing golf. He had never been to a hospital, never had a symptom in his life, but all of a sudden he had a heart attack. And I see this all the time. People say, I feel great, and then all of a sudden something happens, and then you go, what happened? They were the healthiest person I knew. Health is not the absence of symptoms. Health is optimal function. Okay? If we can get your knees and hips and fingers and joints and everything functioning properly, not only will your symptoms go away, you're going to perform much better. But what I want you to understand is this all starts from up at the very top. Okay? So this is probably a little small for you, but we're going to take a very general anatomy lesson. We've talked about the brain. The brain sends messages down the spinal cord. Those messages exit the spinal cord through nerves. I'm not sure if you can see these little yellow lines, but those are nerves that go out from the nervous system, and those nerves go to every part of your body. Your muscles, your joints, and every single organ. Okay, so when you have proper posture and your brain is communicating well, you heal well. Okay, if you looked up a human being in the dictionary, you would see that the definition is we are self-healing, self-regulating organisms. That's what we are. If you cut yourself, what happens? You bleed, you clot, you scab, you scar, you heal. You don't need any help in doing so. Okay? People who get sick, whether it's the common cold or whether it's any type of disease, is because their immune system and their brain and nervous system aren't functioning as well as they should. Okay? At any given time, your brain is telling your cells how to replicate over and over and over and over and over. In fact, I'm not sure if you've ever heard this, but every 7 years you are a new you. There will not be one cell in your body in 7 years that you have today. Your brain's instructing your cells how to replicate on a daily basis. Your skin, your muscles, your bone, your organ tissue, it's replicating all the time. And if it replicated 100% perfectly, we'd never die. But that doesn't happen, because over time stress affects the body and the nervous system, and it starts to break down. If we look at what cancer is the inappropriate growth of cells in the wrong area of the body. And the only way it's called cancer is when they look under a microscope and it's reached several million cells. But everybody in this room, including myself, at this given moment has tens of thousands, if not hundreds of thousands, of cells that are not replicating properly. But it's not called disease because it's not big enough to even see on a microscope yet. But it's happening. But the reason it doesn't turn into disease is because the brain stops it. It says, oh, I recognize that process is wrong. We're going to fix it and move on. It only is when it gets out of control that it's actually called disease. So if our brain is replicating as best as it can and communicating as best as we can, our body heals. And we deal with the stressors that we have. Okay, so basically these slides are just talking about external stress, physical, chemical, and emotional, which we've already talked about. Physical stressors, when do they start physical stressors? From the day we're born. The average child falls over 200 times a year. By the time they're 2 or 3 years old, they've already fallen several hundred times. Physical stress starts when we're young. Okay? Now, one of the biggest physical stressors is our foot. When you hit the ground hits you back with a force. It's the law of opposite forces. Okay? If you hit the ground, it hits you back. Okay? The average person takes 7,000 to 10,000 steps a day. So, when you hit the ground, your foot has to be a cushion. Okay? But when you push off with your back foot, it can no longer be a cushion. It has to be hard, because you can't push off something that's soft, right? You land on it, it's soft. You push off on it, it's hard. So it does that with two motions. Okay? Can all of you see my foot? Yeah? When the foot rolls outwards, that's called supination. When the foot is rolled outwards, it's locked and hard. When the foot rolls inwards, that's called pronation, and that is unlocking and it's soft and cushiony. So if you remember anything, you don't remember the fancy words, hard, soft, hard, soft. So the proper way to walk is to land on the outside of your foot in a hard position. It rolls to cushion the impact. Then it rolls back out and you push off a hard foot. That is called the gait cycle. If I were to take a video camera on someone who walks properly, this is what you would see. Okay? If you look at the back of your shoes, most of you, all of you, should have more wear pattern on the outside. So people will come into my office and say, I'm walking on the outsides of my feet, I need help. Look at my shoes. I say, no, it's not your landing. You're actually landing properly. You're supposed to land on the outside of your foot. But what over 80% of us do is we overpronate. Land, roll, but instead of stopping in neutral, our foot rolls over. Some of you may have heard the terms pes planus or flat-footedness. Okay? Some people are flat-footed. You look at them, their feet are pancakes. That means their foot is overpronated, just standing there. But most people are not flat-footed. They are functionally flat-footed, meaning as soon as they put their body weight on it, it rolls inwards, and they're still overpronators. Okay? I don't want to make any of you who have bad knees do some extra bending. But does anybody here not have a knee problem right now? Most of you have knee problems? Okay, then I'm not going to make you do it. But there's a test that we do in the office that you bend, and you see my knee stays over my toes. Okay, I have pretty good feet. My feet don't really overpronate. My knee stays over my toes. But most of you in this room, if you do this test, what you're going to see is your knee is going to do that, and it's going to roll inwards. And the reason it goes inwards is because the foot is rolling inwards and it's overpronating. So imagine doing this 7,000 to 10,000 times a day, year after year after year. This is how people develop plantar fasciitis, the achy bottom of the feet, metatarsalgia, where you get the inflammation under the toes and it really hurts when you walk, shin splints, because it's tearing the muscle away from the bone, arthritic knees, because it's going inwards. And then as that happens, the hip rolls inwards, so you end up getting hip bursitis, hip arthritic problems. And then as that happens, look at the pelvis, it shifts. Now it's gone right into my back. Over and over and over and over and over. But you see, as we discussed before, the nerves that come out of the nervous system, they don't all go to the muscles and the joints. Some of them go to your organs, right? So you may not get back pain. But after 20 years of doing this, now your kidneys aren't functioning so well because the nerves that go to the kidney have been being compressed for 20 years. Right? Or your bladder issues, chronic bladder problems. Okay? There was some studies done by Dr. Windsor, and what he found was that over 90%, I think it was something like 96% of all diseases can be traced back to compression on the nerves due to scar tissue. And when my dad had his heart attack and they did a bypass surgery, they went in and they found all kinds of scar tissue up at T1 and T2. T1 and T2 go right to the heart, right up at the top of the spine. And this is why I'm so passionate about doing this, because he had no problems. At least he didn't think he did. But he obviously had some major problems going on. So we've got supination versus pronation. We've got the impact of the spine on the spine over time. Now, let's take it up a notch. Again, okay, I'm teaching you guys a lot. If you got questions, please ask. But I want to make this as easy for you to understand as possible. Every joint in your body is constantly in contact with your brain. It's a feedback mechanism. So right now, my wrist is telling my brain it's extending and my brain is telling it to extend. Because if the brain instructs something to do, part of your body to do something, and it's not doing it, it has to know. So there's constant feedback. So if your feet are doing something improper, and that leads to knee problems, the knee shifts, and then the hip shifts, and then the back shifts, and everything is not working properly. It's like putting too much data on your data key or on your computer, and all of a sudden it goes on the fritz. It just isn't working. We call that neurological noise. Your brain can't fully understand what's happening at all times. So you end up getting more and more dysfunction, and it becomes something called a hardwired pattern. I'll give you a good example. I want you to all take your hands, just like this. Put them together. Okay? Which thumb is over the other? Left or right? Right. Most of you are right, some of you are left. Okay? Take your hands apart again. Don't think. Just slap them together again. Is everybody the same as they were the first time? Okay? Try to do it the other way.
Try to do it the other way.
Try to do it the other way. Consciously. Okay? Who found it difficult? It's hard, right? It feels weird. It just doesn't feel natural, right? That's a hardwired neurological pattern because your brain likes to make things easy, right? Anything that your brain can automate and think is normal so that you don't have to actually consciously think about it, it does. But when it starts doing something wrong over and over and over again and it believes it's right, it just takes it as normal. And so over time you develop these hardwired patterns. Most of you in this room that have bad knees, the reason you feel the pain is because the tibia has started to shift on the femur. Even with arthritis, if your knees are in a good position, you don't register the same kind of pain. Okay? When it's been like that for so long, nothing works. Okay, is anybody in here wear orthotics? Okay. You've never seen an orthotic? This is an orthotic.
Oh, yes.
Okay. What it's supposed to do, very simply, is allow your foot to supinate and pronate, but not allow it to overpronate as best as it can. Okay? But you see, a lot of people will come in and say, well, they wear orthotics, it didn't help their knees. These are a supportive device, not a corrective device. If your knee is shifted, you don't put this on and the knee goes back into position. It just supports what's there. That's why I always encourage people, make sure that you're looking after things. I mean, how well do you treat your body? Most 4-year-olds know they go to a dentist every 6 months, right? My kids have been adjusted and taken care of since literally the day they were born. And it wasn't because they were sick babies. It was because if you've ever seen a live childbirth, the medical doctors tug and pull, and your spinal cord is being stretched, and then we wonder what's causing sudden infant death syndrome and colic and all of these things that start when you're a baby. Because natural childbirth, if the doctor has to pull and yank and there's maybe a bit of the baby getting stuck, you're stretching the spinal cord. Now, what process is being in the middle of, at that point, is their digestive tract just having a growth spurt? Was the messages to the brain being cut off for a couple of seconds? This can affect your entire growth cycle and how the body starts to process information. So I remember the day my kids were born, I literally took them from the doctor, put them on the table that they were born on, and I said, I want to adjust the baby. And they said, well, what do you mean? I said, well, you guys just stretched it, and I want to make sure the vertebra is not being shifted. So they gathered around me as if they thought I was about to kill my child. And I took my pinkies, and I just carefully felt where the vertebra was. And I remember my daughter was shifted right. It's about an ounce of force. It's kind of like that. It's just a little nudge, but I'm just shifting the vertebra back. And they all sat around like this, and after I did it, they went, oh, that's it? I said, yeah, what did you think I was going to do? I watched you stretch the neck like this. I wasn't going in to do any damage. I actually wanted to just make sure that everything was aligned and that there was no pressure so the messages could get through. Okay, it's a different concept, but you see, when you go into a medical office, if you have a knee problem, you are a knee patient. If you have a heart problem, you're a heart patient. And if you have a digestive issue, you're a digestive patient. That isn't, when you start looking at brain-based care, and is the brain communicating? It's a whole different story. I mean, I've had people come into my office that they haven't been able to lose weight. And then as soon as we correct the imbalance in the brain, all of a sudden they lose the weight. Because they were already exercising and they were already dieting, right? And same with knee pain. Like you said, I want to know if there's more physio to do. Physio is great, but in and of itself, exercising and strengthening the muscles don't do much if the brain can't communicate properly. I'll give you a good example. I don't want anybody, is someone not in pain? So I want to do a resisting exercise, just so that you can see what I'm talking about.
Okay.
You're good? Come up here for a minute. Okay. Is this yours? Okay, I want you to just take a seat for a second. And I want you to, for a minute, take off your shoes, the flip-flops. Okay, so before I do this demonstration, I want you to see what I'm about to do. I showed you that as the foot goes in, the knee goes in, the hip rolls in, the pelvis shifts, right? That's from the front view. From a side view, the feet roll in, rolling the hips forward. That pushes the pelvis forward, and as the pelvis goes forward, where do the shoulders go? Back. Where does the head go? Forward. So those of you who have forward head posture, and you're like this, we're going to talk about this in a few minutes, but a lot of it can stem from the feet. But for this demonstration, I want you to see something. So this is the posture we're talking about. I'm exaggerating, but this is the posture, right? The back muscles are being contracted because of this, right? Now, there is a law in the body that says two opposite muscles cannot contract at the same time. Otherwise, you wouldn't be able to lift an arm. I mean, you'd be doing this because this muscle and this muscle cannot contract at the same time. So if these muscles are contracted, what has to happen to the abdominals? They have to relax. They can't be working right now, right? So what I want to just show you is, I want you to put your hands across your chest, okay? And when I tell you to, I want you to actually come forward. Okay, I'm going to try, you want to resist me. I'm going to just try and push you back. I'm not going to push too much, but I just want to see what your abdominals can do, okay? Go ahead. Okay, again. See how it's hard for you to keep that contraction down?
Yes.
Okay. Now, I can tell because you have bunions, okay, your feet roll in. The reason a bunion is caused is because you're doing this all the time, and when you do that, it's driving the toe that way. Okay, that's, I mean, it's a sure sell time. It's a good sign. Okay, so what I'm just going to do is, just like a computer, you want to press Control, Alt, and Delete. When you confuse the brain, it resets itself. Okay, so all I want to do, just shaking the foot. Okay, I'm just going to reset the nervous system from the foot. There are more specific adjustments, but right now, for this purpose, this will be fine. Okay, now, if I've done it properly, what we've just done is just reset the nervous system, which means that the brain is not telling the lower back to contract, right? Put your arms across again, come up, okay, and don't let me push back. Can you see the difference? Did you feel that difference?
Yes, I did.
And I probably pressed twice as hard that second time because you weren't budging. You were just sitting there in a contracted state, right? And you can feel they were engaged that time, right? So this is happening all the time. If we're walking around, you've been walking around, I don't know for how long, with these muscles over-contracted, these muscles under-contracted, how are you supposed to deal with back pain if these muscles aren't even engaging, right? And most of that stemmed simply from the foot. So for you, we would need to, A, get you in a pair of orthotics to stabilize, make sure the ankle, the knee, and the hip are all functioning properly. It's going to massively change the way your back is affected. That make sense?
Yep.
Good. Thank you for that.
I do have orthotics. I don't wear them.
Well, now they have
in the
actually,
summer, it's just they won't fit into anything.
no,
so,
that's why we have we
and
deal with
these
a
are
company. They have
very
sandals.
solid enough.
Yeah.
We have companies now. They'll build them into a sandal now. They'll do all kinds of things. Yeah, they're
Good
good.
sandals for that.
Flip-flops are the fashion. Are they good for
Terrible.
feet? You know,
Terrible.
90% of the
Terrible.
people have them.
Well, A, they're
But
terrible,
these
and
have
B,
support.
over the last 5 years, it's really funny. You know, there's been a whole barefoot movement. I don't know if you've been aware of the we've got to be just like they were, you know, hundreds of years ago when they were barefoot, and in Africa where they're barefoot. And I said, well, great, hundreds of years ago, they had to use their feet to climb rocks and trees to go get food and stuff. I don't know too many of my friends that are using their bodies in that way. We're on linoleum floors and cement. I would be okay with the barefoot movement if we were having to use our bodies the same way we did hundreds, maybe thousands of years ago. But to use the argument that now we should go back to being barefoot when we live in this kind of community and society, it doesn't hold. You need support for your feet because you're not using them to climb trees and rocks and everything else. But it is our body's ability to adapt to all of these stressors, because as the brain is communicating down, if those messages don't get through, the body starts to malfunction.
Excuse me,
Yeah.
I know it's a silly question, but if you have an accident and your brain damage,
Yes.
does that mean all your nerves are paralyzed?
Not all, but some. You see, complete paralysis, okay? Christopher Reeve falling off a horse and he was paralyzed. That means it's severed. But most of us, to some degree, the analogy is better to think of a hose and someone stepping on that hose. So you might notice symptoms right away if 80% of that hose is being compressed. But what if 18% of that hose is being compressed? Is it okay for your heart from the time you're 25 to 50 to have 18% of the information, or 32 or 46%? That's why we're all essentially dying and stressed out and exhausted and fibromyalgia and chronic fatigue and irritable bowel. It's because our bodies aren't getting all of the information over and over and over. Okay? If we look at evolution, okay, thousands and thousands of years ago, we were what's called quadrupeds. Okay? Through evolution, we have now developed into bipedal organisms. But look at what happened to my hands. They've rotated out. My body's come up. My head is now going over my shoulder. Okay? Proper posture is even here, even here, even here, ear over shoulder. 90% of your brain, and this work was actually done by a guy named Dr. Roger Sperry, and he won a Nobel Prize for this work on bipedalism. And what he found was that 90% of our brain is used to keep us bipedal. Because right now, I have to balance, I have to fight gravity, we have to have our muscles working, our motor system, okay? 90% of your body's energy and information in the nervous system goes to bipedalism, which means 10% of your brain is used for thinking, immune function, digestion, healing. 10%. 90% just to do this. So if your brain gets stressed, what's the first thing to go? Your body wants to go back to being quadrupeds. So, healthy, the brain gets stressed, the brain gets more stressed. Does this look like anybody that you know? Okay? Most of the people, as we age, our backs go more curved, our heads go forward, our arms kind of go in. Why do you think you get chronic shoulder problems and chronic hip problems? Because it's doing this. Everything is being irritated. Okay? The idea is when you're like this, not only does it affect your mood, it affects the way your entire nervous system is working. When you're like this is a neurological degenerative problem due to brain stress. When our brains aren't stressed, we do this. And this is what my whole practice is based upon now, and I've only been changing it in the last 5 to 8 years. When I first graduated as a chiropractor, if you had back pain, I did back pain, neck pain, I did neck pain, knee pain, I did knee pain. But that is not what the research is showing. The research is showing that due to stress, physical, chemical, and emotionally, our brains are getting overwhelmed, and as our brains get overwhelmed, this starts occurring. And so if I treat just your back without allowing us to balance out the brain, all you do is get worse over time. Your pain may go away for a few weeks, but it comes back. And you may develop other things like heart problems, lung problems, kidney problems, and the like. Okay, so the word I haven't used yet is called subluxation. When our bodies do this, and they start to degenerate, the vertebra can move out of place, the knees can move out of place, the hips can move, and that's called a subluxation. A subluxation is just generally interference in the nerve system, which will affect every aspect of your being, from your emotional state to the way you sleep. Okay? I'm sure no one in this room has ever connected the way their feet work to the amount of rest they feel after they have slept. But it all comes together because the physical stress of your feet is causing your body to do this and the hips to go forward and the body to do this. It's affecting the brain. Now you're not sleeping as well. Okay, your energy level. It's holistic. And when I talk about holistic, it's above, down, inside, and out. Okay, the medical profession runs right now on something called the germ theory. That is the prevailing theory in medicine. And I believe in the next 50 years, they will have found out exactly why the germ theory does not work. Because the germ theory says something out there is affecting something in us. But if that was the case, then every single person that came in contact with bugs and viruses and flus would get sick. But that isn't what happens. Somebody gets a cold, the next person gets it worse, the next person doesn't get it. It's because the germ is not the thing that causes it. It's your body's ability to adapt and to the amount of stress that it's under. And when your immune system is functioning, you don't get sick. When your immune system is not functioning, you do. And so the new paradigm in health is about brain-based care. How do we keep our brain healthy? Okay, in the States now, there's a chiropractor that's leading the Multiple Sclerosis Society in Las Vegas. And at first, the medical doctors couldn't understand how a chiropractor had anything to do with MS. Turns out this guy was also the head of the Parkinson's group, because Parkinson's, MS, muscular dystrophy, they're all degenerative disorders. And it all has to do with what's going on in the brain, right? So instead of looking for cures for all of these separate diseases, why aren't we looking for how to allow our brains to function instead of allowing the stress to deteriorate our health? So subluxations are essentially, they interfere with our performance in every dimension, physically, emotionally, mentally, the expression of our health, the expression of our human potential. When we have subluxations in our nervous system, our body just can't perform well. So again, I'll bring it back to what we're talking about tonight, or supposed to be talking about tonight, which is knees, feet, hips. A lot of people are doing the proper exercises, the proper physio, they're doing everything they were told, and yet the pain is not going away. That is a sure sign that it's not you're doing the exercises wrong. It's that there's some other component that isn't being dealt with. And it's most likely the stress that's going on above. Okay, so this was the Windsor autopsies. I already kind of went over that. We talked about our posture already. We talked about Dr. Roger Sperry, and that posture is a neurologic pattern. So one of the studies, and I usually talk about this, one of the studies that they did is they found that they followed about 1,400 people in a seniors home. They followed them for 4 years. And what they found is the people that look like this, it's called hyperkyphosis, what they found out is they died earlier, and they died most likely from some type of heart problem. And the reason being, when you're like this, your spinal cord is being compressed. So everything that we've been talking about. And it can start from the feet, and if it didn't start at the feet, it can be aggravated by the feet. Okay. Can everybody see this? Okay. This is, well, it's a bit of a brain test. Just by a show of hands, who sees her going clockwise? Nobody sees her clockwise? A couple of you? Who sees her going counterclockwise? You see her both?
Both.
It's going both ways.
Yes, both.
Okay. When you're seeing it both, your brain is shifting from right brain to left brain, right brain to left brain. If you see it going clockwise, that's your right brain. When you see it going counterclockwise, that's your left brain. No, it's the opposite. When it's going clockwise, it's your left. Counterclockwise, it's your right. Okay? So the ability to shift back and forth is important because you want to be able to adapt. You want your brain to be able to go back and forth. But you see, this is sort of it's an illusion because she's not really spinning at all, but it's the way your brain adapts to it. Cool, right? Okay. So are subluxations reversible? What do we do about them? It all depends upon what your issues are. In my office, first we look at the brain. We do something called a nervous system scan, which scans your nervous system, a thermal scan. We want to see where the stress points are. We also do something called heart rate variability, HRV, which is the way you breathe. Most of us don't realize that the heart rhythm can control the brain rhythm. Our heart is the strongest rhythm in the body. There's breathing rhythms, digestive rhythms, there's brain rhythms, okay? But the heart's rhythm is the strongest. And because it's the strongest, all the others can be entrained or be taken over by the heart's rhythm. So if we're talking about controlling pain, if we understand what your heart rate variability is and we can get you to breathe properly, we can have you be able to deal with pain better. Because there are some people who have bad degenerative issues that have been there for years and years and years that it's not going away. But it's how do we get your brain to not perceive as much pain, Okay? You see, pain is your body's way of going, hey, pay attention, there's something going on here. But once you know that you've got arthritis and you're doing everything that you can about it, whether it's exercise, whether it's stretching, whether it's using a cane, whatever it is, you don't need it warning you anymore. You're aware of it, right? You obviously don't want to overdo it, so, pain is important. I always tell people when they have back problems, don't take too much pain medication and then go lift your groceries, because all you're doing is getting rid of the warning signal. But if you're aware of the warning signals, then what we have to do is have your brain not perceive so much pain. And that has nothing to do with the area that you're feeling the pain. That has everything to do with how your brain is adapting to it. So that was the thermal scan. We talked about the posture. Okay. So I usually go, depends upon the lecture, but this exercise is good for any type of stress. Okay? I call it the 3 secrets to stress management. First one for physical stress. It's a good exercise to do at home. Write down all of your past and present stressors. So if we're talking physical stressors, when did you fall as a kid, as an adult? How many car accidents, trips, slips, falls? Do you sit at your desk all day? Do you do a sport? What are the physical things that are happening to your body on a daily basis or in the past? If your list is less than probably 100 things, you're not really putting your heart into this. Okay? You've got to make sure that you've got as comprehensive a list as possible. Okay? Sorry, I skipped that. Secret 1 was what we were just talking about. Getting your brain and nervous system functioning well. Because if they're not functioning well, none of this will work. Secret 2 was taking stock of identify incoming stress, identify past stress, and then make a plan to reduce or eliminate it. So you're going to group things together. If you've got physical stress that's causing neck pain, and you're sitting at your desk all day, and you read in bed like this, and you got to take stock of all the things that you're doing. And then, with someone like myself, or on your own, you look and say, okay, so what are some solutions? Think about the things that you're doing so that you make a plan for each one of them. It could be toe pain, ankle pain, hip pain, back pain, neck pain, and hopefully what you'll find is you don't have to do 20 separate things, that you can combine some of these and make it easy, but have a plan, okay? And that's what we'll do to reduce or eliminate. And then secret 3 is increase your capacity. So does anybody in here have foot issues, achy feet, metatarsalgia? Okay. So some simple things that you can do, practical. Put a water bottle in the freezer, freeze it, roll that on the bottom of your feet. You're going to ice the foot and massage it at the same time. It's probably more effective to actually use a golf ball to massage your foot and then an ice pack to ice it. But if you want to save time, you can roll the water bottle. Okay? Towel grab. Does anybody know what towel grab is? Put a towel up in front of your feet and just start grabbing it with your toes. Okay? You're just trying to strengthen some of the tissue on the bottom of your feet. Okay? Shin splints. Does anybody have shin splints? Achy shins? Good. Knees. I feel like we got a lot of knee pain here. Okay? So again, I want to reinforce. If the knee is not in a good position, you're going to get frustrated because nothing you do is going to work very well. And I'm exaggerating by saying it shifted this much. It may only shift this much, a couple of millimeters, but it's pulling at the tissue around your knee. So the first thing that I would want to do is get your knee into a better alignment. But once it's in better alignment, then there's stretching and there's exercising. Does anybody here, have you ever done tubing exercises? Okay. At home you do these? Okay. So I want to talk to you maybe more specifically about the actual exercises you're doing. But for the knee itself, there's 6 general exercises I recommend. There's extension and flexion. There's abduction and adduction. But the one that most people don't do is, if your knee is straight, you should be doing internal and external rotation. Okay, have you done any of those?
Yes.
Okay, because those are for the little internal rotators. And the reason I suggest this is you could spend thousands of dollars on equipment, but you put a knot in one end, shut the door on it, and then all of a sudden you've got a pulley system, and you do a loop in the other end, and you put it around your ankle, and you can do shoulder exercises, you can do knee exercises, you can do just about any type of exercise you want with just a simple piece of tubing.
So do you buy that at the Canadian Tire?
I sometimes stock it in my office, but you can buy it at any fitness store. I've seen Indigo have it. Most exercise type
What's
places.
it called?
TheraBand tubing. Yeah, and some of them you may have seen like almost flatter sheets of it. It's not a tube; it's more a band. It's all the same stuff. Anything that's stretchy that you can do that with. And then it's a matter of how do you do the exercises, right? 3 sets of 20, 5 times a week. Are you doing the proper type of range of motion? And I'd be happy to go through that with any of you if you want to actually speak about your own individual case. But the same thing can be done with hips, right? Abduction and adduction. You can do hip flexion and extension, all with tubing. Okay. But again, if the pelvis is shifted and the hip is sitting in a bad position, it's not going to do much good just to strengthen the hip up. Okay? It's amazing the changes that you'll see when things are in much more in a balanced position. And I have all kinds of people frustrated with what they're doing until they're starting to be balanced out. I just want to make sure I cover everything. Okay. So that, I think I went over generally most of the information I wanted to cover with the foot, the knee, the hip, and quite honestly, I've gone off in 1,000 different directions. I usually do that. But you see, everything's connected to me. Whether it's an ankle or a knee, I can relate it right back to the way your digestive process is going because it's all connected to the way your brain and nervous system are working. What I'd be happy to do is invite any of you. I'm right at the Yonge St. Whenever I do these type of community talks, I offer any of you in the first couple of weeks after I've done this, we reserved enough spots that if you let Christina know, I'm not going to charge you for your initial exam. If you want to come in and just have a consultation, talk, great. And if there's something I can do to help you, I'll let you know that. And if there's something that I can't, I'll tell you that too and try to point you in the right direction. But I do think it's important that you look into these things and know what your options are so that you can hopefully not only get rid of pain, but get healthy. Does anybody have any questions?
I think the posture is the first concern. You know, you see people, especially tall people, they hunch up as if trying to make themselves smaller.
Yes.
And if only you walk tall, people would look up to you, but they seem to crouch down.
But you see, a lot of times, if your spine is like that, like, you know, the people used to go to finishing school years ago and they used to talk to do this and, you know what, that will hurt if your spine is not able to do it. And we actually, in my office, we do 2 different types of care when it comes to the spine. One is called functional and one is called corrective. The analogy I would give you is it's like dental care versus orthodontics. Okay, if you go to a normal dentist and you're getting cavities because your teeth are crooked and you're getting food stuck in your teeth, if you go to a regular dentist, what are they going to do? They're going to clean out your teeth and they're going to polish you all up, and then you go home, but your teeth are still crooked, and so the food's still going to get stuck, and it's just going to happen all over. If you need corrective work, that's like orthodontics, where they straighten out the teeth. So in my office, we would have to assess what needs to be done, what can be done. If corrective work can be done, it'll be suggested. If it can't be done due to, or it doesn't need to be done, or if there's too much degeneration to do the corrective work, then we work in a functional way. But there are options, and it's not all or nothing. It's, you've got to figure out what your best case scenario is, and then we go from there.
And just something very funny. Last week I thought I would treat myself to a massage. So I went in and the girl said, any particular spot? And I said, well, I wasn't able to walk a lot last winter, so I'd like particular attention on my legs. So she wasn't really good because I had to ask her to put more pressure on and all.
Yeah.
So when we finished, she said, how do you feel? And I said, well, I thought you asked me what preference I would like. And I said, legs. And she said, oh, I thought you said your neck. She didn't touch my legs.
Even though you'd asked.
Yeah.
And then the whole time you just want to
She
relax
wasn't
and you don't want to say
listening.
anything.
And when you going to do my legs? And she said, oh, I thought you said your neck.
Well, she should have said, look, you got another half hour coming to you, and that's for
She
sure.
shouldn't do.
But you see, I love massage. I think massage is great. I think almost all the other healing arts are great. But it's irrelevant if your spinal cord and nervous system are under pressure. You see, most people will come into me and say, well, I've tried that, it didn't work, or I tried that, or massage is good for 48 hours. What's the number one purpose of your spine? Do you know what the number one purpose of it is? It's armor, right? Bone. It's encased in bone. And why is it bone there? Because it's protecting your spinal cord. So it's armor, right? So if your spinal cord is under pressure because of this, right? Your brain's number one job is preservation of species. It wants to preserve the species. So if you're like this, and your spinal cord's now being squeezed, and your brain says, uh-oh, I'm under pressure. If I don't protect myself, we could die. So what does it tell your muscles to do? It tells your muscles to tighten up. And where do we get tight? Right through here and right through here. So we go and get a massage or acupuncture, whatever it is, and it feels great for a few days. But if the underlying problem still exists, the brain will go right back into its protective mode and say, I don't care how good that massage was, I have to protect my body, and it's going to tighten back up all over again. So all of these things can work. You know, I have people coming in and saying their medications don't work, their diet didn't work, their exercise program didn't work. It's not that they didn't work, it's that their brain is not communicating properly. And once your brain communicates properly, all of a sudden these other things start to work. And that is the most important thing that you can take out of tonight, is that if you can get your brain balanced and functioning properly, the rest of the body will follow.
Can I ask you something? I have a friend that has leg problem. They swell up and his feet swell up.
Yep.
And he wears those socks and he comes
Yep.
to the door.
Yep.
I don't know if he should keep his feet still up or what. He's having a problem with that.
It depends upon what the issue is, but it sounds to me like that might be a kidney issue. And if it's a kidney issue, then we've got to look at, again, in the medical system, they're going to look at what's going on with the kidney.
Right.
I'm going to look at, why is the kidney not functioning the way it should? Is it not getting the proper information from the brain? I mean, we had a lady come into us, this was several years ago. She was getting chronic bladder infections. 6 or 7 of them a year, for years, 8, 9 years. She was in her late 30s. Once we looked at her spine, everything from here down was great. She had degenerative issues right at the very top of her neck. And as soon as we corrected those, well, not even before, it didn't even need to be fully corrected, it was only about 3 months into her program, she hadn't had another bladder infection since, right? Because it wasn't a bladder problem, it was a communication issue. That is the message that I want people to understand. Communication, your brain needs to send messages through the nerves. We all understand that pinched nerve when you're getting pain down the arm, your neck pain. Oh, I've got a pinched nerve. Well, those same nerves control your heart, your lungs, your kidneys, your intestines, your immune function. It's the same nerves. You just aren't feeling it because that's not the sensory part of the nerve. When it hits the sensory part, you know it, you try to go get help. If it's hitting the other parts of the nerve, you may not know it for 30 years.
See, he has a problem with the, I can say that, he takes water pills. I don't know.
Yeah, it's a kidney issue.
It's a kidney issue.
Yeah, and again, of course you don't want to ignore the kidney,
Right.
but at the same time, you want to be able to address the brain stuff. I mean, I've had multiple people get off blood pressure medications. We didn't do anything other than fix their nervous system and spine, but their blood pressure went down, right? So when people ask me, do I treat heart disease, do I treat cancer, do I treat kidney problems, I don't treat any of it. We're not treating a disease process. But on the same side, we're really not treating neck pain, we're really not treating back pain. What we're treating is the nervous system and the brain. And as it balances, the body goes with it. Okay, we really, it's an amazing system. If it's very simple and delicate, you just need to know where the pressure is and allow the body to communicate.
So could you just very simply then explain about the brain and how
Yeah.
it can go out of whack and cause all of this
Well,
stuff?
your brain has to adapt to stress all the time.
But let's say
Okay.
you're not stressed.
But you
I mean-
are. But you are. What you're talking about is you might not be emotionally stressed. We all have stress on our nervous system, and it happens over years. Some more than others. But there is not one person here that isn't withstanding gravity right now and has stress on their nervous system. It's happening constantly. But it's elevated, and again, this gets into a whole other conversation, but we are all stuck in what's called a sympathetic survival syndrome, which means our bodies are in fight or flight all the time, and we were never meant to be in fight or flight. We're going to talk about this a lot at the next lecture, but it's probably another hour of explaining how stress affects the nervous system. But to answer your question as best as I can, your brain over time has to constantly adapt, and when it's stuck in a stress mode, it's not able to stimulate the immune system properly. It's not able to communicate properly. And simply because of the effects of your posture changing and creating those subluxations which are putting pressure on the nerves, just think of it as someone's constantly stepping on the hoses and the water's not getting through, so the body's not functioning well. And that will affect every part of your body. From eye function to ear function to, all of it.
So you're saying then that this is kind of a cumulative thing. It's not
It's-
just because you're
No.
working at a desk all day long. And
No,
all of a
this
sudden
is-
you get so you're
this
saying
is
you're
extremely
tired.
accumulative. If it was one day, your body could adapt.
Yeah.
Because we're all able to adapt to stress. If we're healthy, boom, our body's meant to adapt to stress. But it's not meant to adapt to a constant stress year after year, day after day. You see, over the last 50 years, it's just amplified. There's more information now than there's ever been. There's more technology than there's ever been. When you watch the news, your brain does not differentiate between an earthquake in Taiwan and you experiencing it here. When you watch the news and you hear about so-and-so being kidnapped and so-and-so dying and this and that, your brain's taking it all in. And then the processed food and all of the chemicals that we're putting in our body, we don't know half of what we're putting in our body at this point. Nowadays, gluten and how many people are gluten sensitive and dairy insensitive, it's not only because those foods are bad, it's because of the way it's all being processed. 50 or 100 years ago, not nearly as many people were sensitive to wheat, but we don't know what's going into all of our wheat now, all of the chemicals and all the processing and everything else. It is having an effect on us, a cumulative effect over time. It's funny, one of my friends, you'll definitely hear about him, it's called it's called Next Millennium Farms. They are now generating the healthiest kinds of protein that we know exists. And it's made from crickets. And they are now making protein powder out of crickets. And they are now the only company in Canada that's licensed to do this. And they will be worth probably $1 billion in the next 5 years because they can produce, on average, far more protein, far cheaper, far cleaner, less processed and everything else with crickets than they can with cattle or anything else. And quite honestly, no one in this room, if you didn't know it was crickets, would taste the difference or know when it's a very pure form of protein. And our kids, if we fed it to them, wouldn't care. 30 years ago, no one ate sushi. Now it's like whatever.
Have you tried it?
I have tried it, and you wouldn't even know the difference. But can you imagine how much protein they could feed the cattle now if they made it out of crickets? Third world countries to ship them bags and bags of protein powder made of crickets that at a fraction of the price. I mean, it's astronomical, and I'm kind of kicking myself I didn't get into the cricket business, but it's just another way of the amount of chemical stress we're putting in our bodies. So I'd love to, when people say to me, but I'm not stressed, I don't want to argue with you because what you're telling me is that you don't feel a lot of emotional stress, and that's a blessing, that's awesome. but we're all under stress, and we all deal with it on a daily basis.
We should all buy shares in Cricket.
Honestly, as soon as it comes out, you should.
Have they issued an IPO yet?
Not yet. They're actually raising capital right now. It's literally, if you look at them on Facebook or on the internet or whatever, they are just now growing. Do anybody here watch the Dragon's Den?
Yes.
Well,
sometimes.
there was some guys that were trying to sell a protein bar made from crickets, and they got some investment from Mark Cuban. And after the show was over, they went and phoned my friends because that's who they're getting the protein powder from to make these protein bars. It's really a burgeoning industry, but yeah. Anyways, that's a side point. So listen, anybody here that wants to discuss more, if you want to come in, just discuss with me about your own individual health, see if I can help you out. Just let Christina know, she's here. Give her your name, tell her when you're available. When you come in, we'll talk, and we'll just see if I can help you. Okay? But I appreciate you guys coming out on your Tuesday night.
Thank you very much.
Do you have physio equipment?
I do not have physio equipment as an ultrasound. That isn't my thing. I'm very happy to guide you towards where there would be physio.